or my research focuses on Aboriginal communities and health of individuals living in those communities. And as you're probably all aware, Aboriginal Canadians in Canada have higher morbidity rates and higher mortality than the general Canadian population. So in the next 3 minutes or so, I want to convince you of the importance of changing social conditions to improve health outcomes for Aboriginal Canadians, and that it's not Aboriginality that contributes to poorer health, but the circumstances of people's lives. Health Canada publishes reports such as this one, Health Determinants for First Nations in Alberta, that document lower education levels, lower labor force activity, and poor housing conditions, for example, among First Nations. Why is that relevant? Well, according to the World Health Organization, the social conditions in which people live and work can help create or destroy their health. Poverty, food insecurity, which I'm going to touch on briefly, social exclusion and discrimination, poor housing, unhealthy early childhood conditions, and low occupational status are important determinants of most diseases, deaths, and health inequalities. And we happen to have in this room today Cheryl Curry, who's doing some wonderful work, who actually shows that Aboriginal culture is protective for health for Aboriginal persons. So it's obvious that to improve the health, at least it's obvious to me, to improve the health of Aboriginal persons, the economic and social conditions that influence the health of individuals and of communities must be modified. So for both Aboriginal and non-Aboriginal Canadians, food insecurity is an important determinant of health. And what is that? It's not just hunger, it's more than hunger. It's the limited, inadequate, or insecure access of individuals and households to sufficient, safe, nutritious, and or personally acceptable food. And for Aboriginal persons, that might be wild game, for example, food that's culturally relevant, both in quality and quantity to meet their dietary requirements for a healthy and productive life. I published a study recently in Public Health Nutrition where I examined Aboriginal and non-Aboriginal households that participated in the Canadian Community Health Survey completed in 2004. So this national survey collected data on household food insecurity and health indicators. I found that 33% of Aboriginal households located off reserve were insecure as compared to 9% of non-Aboriginal households. So that's a tripling. What was even more disconcerting if we looked at the prevalence of severe food insecurity, which likely implies that people within that household do actually endure hunger, the rate was 14% in Aboriginal households. 14% where people may be going hungry versus 3% of non-Aboriginal households. I then went and looked at the prevalence of socio-demographic risk factors for household food insecurity, which was much higher for Aboriginal households. Aboriginal households were more likely to have 3 or more children, be lone parent households, meaning headed by a single parent, usually women, not have home ownership, have educational attainment of secondary school or less, have income from sources other than wages or salaries, and be in the lowest income category. So it's obvious from these findings that there was a clustering of disadvantage among Aboriginal households, with the most vulnerable being households headed by women with 3 or more children, the most vulnerable members of our society. So typically when we talk about what do we need to do to improve our health, we tell people to eat more fruits and vegetables. We tell people to drink alcohol in moderation, to avoid too much sun exposure, to exercise. I'd like to leave you with some tips from a determinants of health perspective to improve the health of both Aboriginal and non-Aboriginal persons. This might be recommended. Don't be poor. If you can, stop. If you can't, try not to be poor for too long. Don't have poor parents. Don't live in a deprived area if you do move. Be able to afford to own a car. Practice not losing your job and don't become unemployed. Don't work in a stressful, low-paid manual job. Don't live in damp, low-quality housing or be homeless. Be able to afford to go on an annual holiday. Make sure you have access to benefits, particularly if you are unemployed, retired, or sick or disabled. Don't live next to a major busy road or near a polluting factory, or in Alberta near to Fort McMurray. Don't be a lone parent. So I hope in this short period of time I've convinced you that we need to take a social determinants approach to improving Aboriginal health. It's not destiny that certain ethnic groups in Canada or certain socio-demographic groups have poor health. With political willpower, people can be better enabled to have good health. Thank you.